Hi.
Who you will meet. Thank you for reminding me. All right, so I'm going to introduce you to the other two coaches who will be in the program with us. And then I'll introduce you to my husband formally, because he is the person who manages all our tech and systems and customer service, etc. So, the first person I want to introduce you to is Kendall. She is PDA autistic herself and a mom of four gifted PDA children. So she is our resident specialist in larger family dynamics. And a common thing with this program is that parents often get more clarity on their own nervous system and neurodivergence and or identity. So Kendall is your identity doula from that perspective. And she began with the Paradigm Shift program as a student. And now is part of our coaching team. And she will be in our online moderated community about 8 hours a week, supporting you with direct answers to your questions alongside Donna and myself. And she will also present a special live session about giftedness, internalized PDA, and anything else she wants to share because each cohort it's different. So, Kendall, would you like to take a moment to say hello?
Yeah, hi everybody. It's so great to see your faces. I always get really excited on this call to just kind of see who we might be working together with in our next cohort. So yeah, as Casey mentioned, I started as a student of this program and it completely transformed my own life. And that's why I'm so passionate about the work that I do with At Peace parents, including the online moderation. We strive really hard to keep it a really safe space because we're talking about really vulnerable things in this group, and it's a really beautiful place to be. And I've seen some amazing transformations in the online community with parents, talking with us as coaches, but also with each other. I mean, it's an amazing opportunity for you guys to connect with other people who actually live a similar life to you, which is not a luxury that us PDA parents always get. But I'm really excited to working with whomever of you sign up for the program. I know I've been in touch with some of you about waitlist, just waitlist stuff in general. And yeah, any questions you have, feel free to email me to ahead of the program and happy to answer anything and looking forward to getting to know you guys.
Thank you, Kendall.
Yeah.
Nice to see your face.
Same.
Our next coach is Donna Georgian, and she has been working with the Paradigm Shift program. I think this is like the fifth or sixth cohort. Correct me if I'm wrong. Um, Donna is a mom of two PDA women at this point. They're 20 and 27. Is that correct? One of whom has complex health issues in addition to PDA as a nervous system disability. So Donna is um, our specialized support for families with teens, tweens, and even young adults who decide to join this program. And she also, to me, just embodies radical acceptance and a lot of the spirit and energy behind the work that we do with families. And I'm constantly learning from her and Kendall. So I'm just so happy to share her with you in the community and in our live session. So, Donna, welcome.
Thank you. Thank you, Casey. I truly am so happy to be here because I do think it's a community of all of us parents together raising unique individuals with unique needs and having the family of others who understand it. It just is, it goes a long way. But as Casey said, that I represent tween, teen, even some young adults. And I can relate so well to those of you who have tweens and teens and young adults because you've been doing this parenting thing for a very long time. And you have tried, probably, if you're like me, tried every medication every strategy, every approach, listen to everybody who's out there trying to do the right thing. And yet nothing seems to work. It only seems to get worse. And not only is it hard for your child, but it's hard on you because you're saying, oh, they're 12, they're 15, they're 18. What am I doing wrong? And the truth of it is you're not doing anything wrong. You are an amazing parent. But what our kids need is something very, very different. So generally the folks that the parents who are in my situation fall into two schools of thought. One is I'm afraid to do this because the future is getting closer and what if it doesn't work? Right? That's fair. And then the other school of thought is I'm afraid not to do this because nothing else has worked and I need an alternative. I need to know there's something out there that can work, and I need to have some sense of hope. And that would be what I would be speaking into because our lives are radically different, radically transformed by acknowledging PDA as a nervous system disability. And so I would like for you to know that there is somebody also on the team that understands what it's like to go through those years, knowing that you are probably very burnt out yourself, right? Probably feeling pretty beat up, but you are going to be in a community of others who understand, who can uplift you, and can listen to where you're coming from. So, thank you for being here, and just please know things can get better. They definitely can.
Thank you, Donna. Nice to see your face. Okay, last person besides our bonus sessions that you'll be interfacing with in the program, which is my husband. His name is Jake, and you may have corresponded with him, but if you lose your login, if you can't find a module, if you need reimbursement, an invoice, receipt, if you want to add a grandparent or a therapist to those master classes that are included, or really anything tech login co-regulation wise that you need that I can't provide, he will provide to you. And he also, as a dad and the lead parent of my PDA son at this point, will run 3 live sessions just for non-lead parents, which the data shows are most often dads, but not always. And he will also run a circle in our moderated community, which is not on social media, it's in our web platform for non-lead parents. So without further ado, Jake, would you like to say hello?
Sure. Hi, everyone. I recognize some of your names from email, so nice to see your faces or at least see your names again. I'm glad you're here. Casey, it's nice to see your face too. It's been so long. Um, no, as Casey said, like I am here to help in many ways. Um, Lead parent versus, I just saw the question come up in chat, so I'll just answer it real quick. So in many families, there ends up being a more lead parent and a non-lead parent. Typically, the lead parent is the person who the parent who the child tends to gravitate towards, or who just ends up spending more time with the child. It can play out differently in different families, but often dads are the non-lead parents. I was for a long time, and then at a certain point with our PDA son, it actually switched, and I became more the lead parent. And there are distinct challenges and joys in both roles, and so I, try and help parents, particularly non-lead parents, because Casey does the heavy lifting for all parents. But I, in our non-lead parent circle, I try and help parents sort of understand some of the feelings they may have, some of the challenges they may be facing, some of the connects or disconnects they may have with their children, and in some cases their spouses, because it can be challenging that way too. So anyways, much more on that to come. The other thing that I'll be doing in the first week is I host a tech navigation session. It's a live session. It goes along with we have an onboarding manual and we also email out instructions. But some parents who are less comfortable on technology like to just have somebody like walk it through with them. And so that's what we do. It's usually like between an hour and 2 hours of just sort of like we're on a Zoom call. I walk through all the technology of the program so that people are comfortable with it, and try and make sure everybody knows how to like log in, how to access the podcast if they want to, how to find the PDFs, as Casey said, like where they go if they want to, get their child's grandparent to log in, where they go if they want to submit a question for Casey in one of the Q&As. Like it just, it's a large program intentionally because Casey's trying to give you everything you need. But we also don't want to overwhelm people with the technology. And so I try and help people walk through that. I do have on my team a woman named Helen who is not on the call today, but she is also a parent of a PDA. She is very understanding. She's an alumni of this program, so she's been in all of your shoes. And so when you do email us, you'll likely hear from either me or Helen. If you're doing a receipt or an invoice or something like that, you may hear from one of the other people on our team, Huli or Juliana. But just rest assured that like none of us are judgmental people. Like we understand you all have a ton on your plates. You're dealing with more than any parent should have to deal with. And so like our goal is to try and make things work for you. So please do feel free to be in touch anytime you have questions. The email journey@peaceparents.com. You'll get usually me or Helen, and we're happy to help you out. I think that's all I got for now.
Thanks, Jake.
Sure.
Awesome. So the tech session is also, if you're ADHD, a body doubling session. So if that helps your nervous system navigate learning around logging into a new program, etc., that's what we got you for. Okay. All right. I'm going to dive into what we're going to do today. So today we're going to do 7 things. I'm going to spend about an hour and a half, but if people have lingering questions, I can stay on longer. We're going to do 7 things. We're going to talk about the goal of this program and how we measure success for yourself and your child. We're going to talk about how we achieve that success, what the program is and what the program is not, the logistics and details of the program components, the methodology, and our Q&A. Okay. And I'm going to start with a story, but before I do, I just want to, in case anyone needs to drop off, say what the purpose of this program, the goal, in the most simple way possible so that you get the nugget. Okay, so basically, all of us, parents, therapists, teachers, physicians, are operating under the assumption of a paradigm or a way of thinking that is that we need to, in order for children, whether they're neurodivergent or not, we need how to teach them explicitly how to be good through incentives and disincentives, consequences, rewards. And if we don't explicitly teach them, then they won't learn, they won't grow, they won't be happy, they won't be independent, right? For our uniquely wired, but also different logic of the brain and nervous system, PDA children and teens, what you're learning in this program is to see things and operate through a different paradigm than that other one, which is what we all know as the conventional wisdom, which is instead of giving them rewards and consequences, incentivizing and explicitly teaching them, our goal, especially if your child is close to their threshold of perceiving threat all the time or in burnout, is to lower their overall nervous system activation below and create a window of tolerance so that instead of what you see now, which is them operating from the survival part of their brain, we're getting them back into their frontal lobe, and you're going to see the child behind the threat response. Okay. And instead of explicitly teaching and incentivizing through more traditional parenting, we're going to lower the threat so that their heart space and frontal lobe can actually be seen and operate. And we're going to be modeling in our behavior what we want them to learn. Because when we directly try and teach a PDA child or have expectations, it is constantly perceived as losses of autonomy and equality, which shuts down their ability to learn, connect, empathize, etc. Okay, so that might sound like it's high up in the clouds. The way paradigm is a word that not everyone feels comfortable with. So what we do in the program, and this is what's different from like social media, the podcast, and even the foundations program, if you took that, is we're going to not just learn information, but more so, we're going to implement 21 skills and practice them live together for 3 months. Okay. And I'm going to talk to you about what that means. And then in addition to that, you're going to be getting nervous system support in order to take action. Okay. Meaning you're going to be in a community with a sense of belonging, direct support from live humans. There is a pre-recorded component, but I will be in the moderated community. I will be with you 2 to 3 hours a week live at least. And we will also be bringing in a nervous system healer to teach you strategies for your own nervous system so that you can actually move beyond the information about like, okay, I know that if I correct the behavior, they fixate on doing the behavior. We can know that and not actually change our behavior because there's that little voice inside our head that's like, we have to be the authority. They can't act like that or they're going to be abusive, etc. So we're going to learn how to see differently and act differently, help you implement and take action and support your nervous system while doing so. So that's what makes this program unique. I'm going to pause. Did everyone understand what I just said? Does that make sense? You can give me a thumbs up. You can give me a thumbs down. You can drop in the chat. Okay. Herb, Amanda, Megan, you guys picking up what I'm putting down? Or Eric, Laura, Nikki, Nod, Robin? Okay. I want this to be a little bit interactive just because it's like about you getting the information you need, not just me talking at you. Okay. So I want to start with a story that is unique to me and Jake, but actually illustrates some of the dynamics that I think most of you have experienced. So on Father's Day, 2019, I was in a really bad place. I was working full time at a research organization in Washington, D.C., and felt very competent in my career, but would like dread getting on the metro to go home every night and hated being at home with my son because I just felt like I was a terrible mother. He needed constant one-on-one attention. He was constantly hurting himself, very defiant, increasingly not eating, etc. And he had started to have troubles with accessing eating, like moving. Like he would say, my legs don't work. I can't do the limp noodle. And he would go into these feral meltdowns that if I tried to approach him, it was like kicking, biting, screaming. This was around 4.5 years old after my second son had been born. And I remember on Father's Day, I had wanted to give Jake a break from parenting, but I was like, I have to go to yoga. And I just sat in the yoga class weeping and was like, something is seriously wrong with my son. And I had been seeking support from like pediatricians and therapists, and like people were like, he'll grow out of it. He's fine. You need to take parenting classes. And I came home from yoga. And as soon as I walked in the door, there was my little baby there and my PDA son, and he started to escalate. And he threw oh, I think he did this after, but he started to escalate, and what I would have to do is I would grab the infant, put the baby in the Bjorn, and go out in the street to get him out of the line of fire because it was just like my son would be in total fight or flight. And so I did that. I was on the street, a neighbor came by and like saw me weeping and was like, "Is everything okay?" And I was like, "No, but I don't know what's going on." And I had left Jake behind with Cooper, and he had thrown like Jake was trying to be like, "You can't act like this," the traditional approach to how we respond to quote defiant behavior. And my son threw a really hard toy and hit him in the face. And so then Jake went like, as a consequence, I'm going to take this and put it in the basement. You can't use this toy anymore, which seems like, traditional parenting. And my 4.5-year-old son slammed the basement door and locked my husband in the basement. So we have this 4.5-year-old who's like a whirling dervish of destruction, and it's not safe. And I'm out there crying and weeping. And we called the pediatrician. My husband actually eventually got out of the basement, and we called the pediatrician, and they were like, they gave us two possibilities. You can either take him to go get ice cream, or you can admit him to Children's Psychiatric Hospital emergency room in DC. And I seriously considered it because that was the point at which I just like could not deal with what was going on. And my mother-in-law, thankfully, was like, don't send him to the ER, drop him off at my house and like get some space because we were so activated and so frustrated and scared that we felt like we were not going to parent in the way that we wanted to. And my son, I now understand as soon as he got to his mother-in-law's or his grandma's apartment, went into dorsal or shutdown, which is like the nervous system drops from fight flight into like freeze and shut down, and didn't speak during those 4 or 5 days. I decided to leave my career and move back to my home state because we realized that no matter how much we tried to communicate and seek support, we were belittled and told it was our fault or that we were overblowing things with what was going on. And so we had this aha moment that no one was going to do this but us, right? And that has proven to be true. But I say that because I know that whether or not your child is externalized, like my son, like very fight, flight, very defiant. Maybe you have a 13-year-old who's an internalizer who never is violent or defiant and is a teenage girl. The experience of the confusion, the isolation, the pain, and having people not believe you, I think is a universal experience for the parents that we work with. So our goal of this program is to save you a lot of that pain, isolation, trial and error that took us so long. So I'd love to hear from you if, even if the like throwing things, screaming, feral animal doesn't resonate, um, have you felt that isolation or judgment from professionals? Yeah, it seems to be kind of a universal experience for parents of PDA children and teens. Yeah, not from professionals, but from family. Absolutely. Despite tons of accommodating, life gets lifey, and the violence is still something we don't know how to handle. It's scary. Yeah, so we'll go over some of the accommodations that we use with that. Yes, okay. Thank you guys for sharing. All right, so this program is, people often ask, okay, so like, what is this program based on? So it's a combination. It's a combination of my lived experience, our lived experience as parents, research into trauma, neurodiversity, and PDA, um, and polyvagal theory. So I have a certificate in polyvagal theory, and really the bird's eye view of working with over 2,000 families only parents who have PDA children and teens. So that is really the focus of what we do. This is the 11th cohort of the program. So if you choose to join, you will be the 11th cohort. Um, there are three things that really make this unique, and I'm just going to speak frankly. So when I first started learning about PDA, it was very doom and gloom in the support groups, the online support groups, the writing that had been done. Um, and I remember thinking, like, this can't be the story of my family. Like, this can't just be it, that we're just doomed to, pain as parents, but also a child who's unhappy and not thriving. Um, Additionally, when I looked for support in the clinical space, to be frank, I did not see clinicians who could deeply understand the true trade-offs that parents were making and the cost of accommodating to the parent's nervous system and to their life. Because unlike other disabilities and neurotypes, you are the primary accommodation for your child, and you are constantly making what I call a cost benefit decision, which is, do I set this boundary, say no, or set this limit and take on the cost to my child's nervous system, which in accumulation makes their behavior worse and starts to impact and or disable them from their basic needs, safety, hygiene, toileting, sleep, and or eating? Or do I not set the boundary, but then I am stuck with a sibling who feels like they're getting abused? I can't leave the house. I'm delivering them food, etc. So there's this unique cost benefit decision and experience that was not being acknowledged, I did not think, in the clinical space. On the other side of things, in the more advocacy space, I saw a lot of judgment and blame on parents, even if there was good information. And so the reason I started this business and this program was in the gap that I saw left behind for parents wanting to make change in a way that took into account the duality of the experience of the parent and the child. And I personally view and believe that parents are the catalyst for the change in the child. Okay. So, second, um, this is a personalized program, meaning it's designed around parents more than it's designed around children. Your children actually aren't even on the call, right? They can be, like, no problem. But we have universal design, meaning like we have transcripts, captions, different ways to engage in the material. You can listen to it as a podcast, etc., because I know from my work that many of you have access needs and are neurodivergent yourself. Whether or not you know that at this point, it's a pattern. I keep very tight boundaries in our moderated community and in our community dynamics, because I do not want to replicate some of the support groups I've seen online. And our team of coaches provides direct mentorship and support. So it's not one-on-one coaching in the sense of like, I tell you advice or what you should do, and you can have access to me at all times. But rather, you're taking the materials and what we're working through and you're applying them to your own life. And where you're getting stuck, we can help you get unstuck in the moderated community. And I can coach those of you who submit questions in spot coaching during our live sessions. Okay. And then finally, this is, again, as I said, designed around the parents. So in the 9th cohort of the program, the University of Michigan did a pre-post evaluation of this program with parents to see its impact on both the children and the parents. And we are still doing another study that will intersect with this. It was done without me. I just did the recruitment. but the preliminary findings are showing 13 statistically significant and medically meaningful positive impacts on parents, including but not limited to reduction in anxiety, depression, caregiving burden, and improvement in connection. Okay, so finally, we're going to combine compassion and co-regulation and witnessing with science, meaning we are going to be doing everything through the scientific process. It's not going to be overly technical, but that's the spirit behind it of we have a hypothesis, which is that your child is PDA. We're going to be putting on the PDA lens, operating through that lens consistently with an experimental mindset, meaning you could do this for 3 months and change your mind and it's okay, right? And often with the non-lead parent, this is supportive for them to get on board because often parents are at different mindsets or pages with how much they accept and buy into a different approach. That's very common. And so if we can take it as an experiment with a time-bound boundary, and then learn how to track, to define, measure, and then track data that's relevant to your child's well-being, then we can decide for ourselves whether or not what we're learning here is working for our family and communicate more effectively with professionals, spouses, teachers, and therapists. So we are going to learn that in the program. And finally, because I'm working on a peer-reviewed journal article, a quantitative peer-reviewed journal article for a new measure on PDA called instead of the Extreme Demand Avoidance Questionnaire, we have a new measure that we're going to be submitting the peer-reviewed journal article to in the next month. I will be bringing the most up-to-date understanding of PDA to the program. So the initial findings of that have corroborated my conceptualization of PDA as a nervous system disability with an impact on basic needs, not just behavior. Okay, so could you clarify the group size and points of interaction? Yeah, so can I save that, Catherine, for the logistics part? I'm going to put a pin in your question and I'll go through like every part of your question. Okay, so what is the goal of this program? How do we measure success? So for the purpose of this program, my goal is to give you everything that you need for the rest of your child's life, to learn all the skills that you need, including decision making, not just accommodations. So in the first 3 months, we will have data while you're in the program. And in terms of how things impact you, I want it to improve your mental health, your confidence and empowerment as a parent, and heal some of the trauma that you've been through. On the part of the child's well-being, what we're going to learn to measure is 3 things. Cumulative nervous system activation. Okay, so like if we're looking at a child and when they start the program, they are still in school, and when they come home and on the weekends, they equalize, which means they have sort of like abusive or controlling or manipulative behavior to the mom and their sibling 75% of the time. The other 25% of the time, they're sort of like regulated or at least not engaging in equalizing. That's one indicator that we would look at the end of the program. Like, okay, equalizing has come down to 25% of the time instead of 75% of the time. If we're looking at episodes of nervous system activation, they could be more fight flight, like my son, which might be like a meltdown or a panic attack or a rage, however you want to frame it. Maybe when you start the program, it is, 1 hour meltdown on average 3 times a week, and they're throwing things. By the end of the program, we're not going to get rid of, oh, all of a sudden there's no meltdowns and there's no equalizing. the course of 3 months, we're going to see shifts like, okay, 2 times a week for 30 minutes. Okay, we're going to be measuring progress, but this is a long-term approach. It's a sustainable, long-term approach. It is not a quick fix. Okay, if there was a quick fix, you would have already learned it, and so would I, and none of us would be here. Okay. Um, then we're gonna, if your child is more internalized, you might have a different measure for nervous system activation. It might be freeze or shutdown episodes. This can look like selective mutism. It can look like dilated pupils, faraway look in their eyes, completely lethargic, non-communicative, going into a turtle shell. So those are the types of indicators we would talk about in the nervous system activation category. They're going to be specific to your child, and I will illustrate that through the spot coaching, and we can work on it in the community. The second category that we would be measuring in terms of the impact is felt safety, engagement, and connection to you. So we're going to look at ways to measure this that aren't based in more neurotypical conceptualizations of connection, like all of us, I mean, not all of us, but some of us start out where it's like, I want to feel connected to my son by having a conversation that's reciprocal and playing a board game back and forth and him answering questions and asking me questions. That is not how my son connects. And for many of your PDA kids, we have to look for other indicators of how is connection improving through these approaches that we're trying in terms of a different way. So these might look like a teenager who has not left their room for 3 months, but as we start shifting the paradigm and doing the skills that we're learning, they start coming into the room that we're in. They're still on their phone and they're doing parallel play, but we're seeing some progress of connection. Maybe, I've had families in the past like post a video of like, my son who wouldn't let me touch him for a year. They send in a picture of them like holding hands and watching a video together or squishing. Info dumping, giving you gifts, researching your interests. So we're going to learn to see those connection indicators differently, and look for them in terms of where you are now and where you want to be by the end of the program. And the program is the foundation. This is like, in terms of getting a child out of burnout, I would say if they're below 11, it's more like 6 months to a year. If they're a teenager, it's probably going to take longer because it's based on cumulative activation and we need to reestablish the relationship. Okay. And then we're going to think about, as a third indicator that we're measuring for the impact of the program and your work, actually, it's more how you apply this program because you're the one doing the work, is their access to basic needs. So for the majority of PDA children and or teens, especially if they're near their threshold for how much stress they can have in their system or they've gone into burnout, we're going to see one or more basic needs impacted. So this can look like, in the eating category, compulsive eating, like they won't stop eating. It can look like very restricted eating, which is the example that I have from my son. In toileting, for a younger child, it can look like maybe they were fully potty trained and then there was a quote regression and now they'll only poop in a diaper in the bathtub or they won't wear pants. It could look for an older child or teen still needing to wipe them, accidents. It could be constipation or encapresis, um, hygiene. It could be, they haven't brushed their teeth in 6 months or 2 weeks or whatever it is, or they like physically fight you or refuse to take showers. Um, and then safety, I talked about sort of like my son's externalized violent behavior, but for more internalized expressions, meaning going inward into freeze or shut down more. Um, and usually for more like tween teen examples, this might look like self-harm, suicidal ideation. So we don't provide crisis intervention. You need to be working with a therapist or a medical practitioner, but in terms of conceptualizing this, what we see is that as parents accommodate and change the paradigm, we can actually measure the decrease in self-harm or suicidal ideation. I mean, parents are tracking this. Okay, so let's just take a minute. I know this is tough stuff to talk about, but this is like the type of things that families are experiencing, and maybe it's not so extreme, right? Like maybe your child has constipation issues when nervous system activation gets amped up. Now for my son, these are much less pronounced because we've brought down that nervous system activation. So I'd love to hear from you all if you want to just name like which of the basic needs is the stickiest for your child or teen. So you could say, um, eating is our biggest struggle, or yeah, all of them. So if your child or teen is very much in burnout, all of them may be affected because these are the physiological impacts of a nervous system that's constantly activated, and control tends to coalesce around one or more basic needs as their losses of control are continually perceived. Yeah, so Lisa, I think of school as a secondary need. It's an important one, but in terms of like the what makes it a disability, it is these 5 things we need to stay alive, right? And then we can think of secondary needs, secondary basic needs, like leaving the house, movement, learning, etc. Okay, great. So we're seeing eating, all of them hygiene, eating, toileting, safety, hygiene, eating. Yeah, the OCD, Annie, the OCD PDA combo is a tough one. Eating, hygiene, connection. She hates us all the time. So yeah, that's something you can definitely track. Like as you move through the program, that's something that should change over time. Sleep, going to sleep, sleeping independently, hygiene. Child hates to shower, eating, sleeping, hygiene, sleeping. Yeah. Okay, great. Thank you so much for sharing. Wonderful. Okay, so what about a year or more out from the program? So this is when parents email me. It's usually a year. And we're actually going to be bringing in a lot more of these voices onto our public podcast. But some of the emails I've received are some of the following. I can finally go out to dinner with my husband because when I come back home, my tween doesn't threaten suicide anymore because I left, because of the loss of autonomy. My son's eyebrows have grown completely back after plucking them due to the stress and equalizing towards self. My daughter gained 20% of their BMI back after it was dangerously low and at 1%. My child is thriving in a neurodiversity affirming school and saying, I feel better in my body. We have decided to unschool our child, and the relationship has completely changed, and there's no more violence. Um, and then other emails like healing childhood trauma, relationship with your parents is completely different. You stepped into a new identity or direction. You're starting a nonprofit, a new school, a different career. Okay, so your experience is very much tied to this program, right? Like you are this catalyst for the change, so it will also impact you. Okay, so how do we achieve this success? So, 4 things: clarity, teaching you to see through a new lens, right? So, this includes helping you understand how to identify like, is this ADHD driven? Is this autism, like non PDA autism? Is this sensory? Is this ODD related? Because a lot of the surface level behaviors can look very similar. Okay. And they can have different root causes, but until we change what we're doing, we can't actually isolate what's causing what. Okay. We're going to work on not learning information about 21 skills. We're actually going to implement and practice the 21 skills so that you can refine, deepen, and feel confidence in your skills that you need to shift things. And I'm going to tell you what those 21 skills are. A core of this program is radical acceptance. Okay, so module 2, which I'll talk about, is all about acceptance, and it is the paradox of accepting the limitations presented to you by your PDA child and the things you can't control as the first step to transcending those limitations. So most people will come into this program, I would say about a third of the people in this program will be new to PDA, and the other two-thirds will be like, I've already lowered demands and I've already done everything. And the missing piece is the acceptance piece, because there is a tendency for all of us to try and control outcomes and use accommodations to make the child behave or do something in a different way. And PDA children and teens can perceive that energy and will do the opposite. And finally, this is about you finding your unique path or direction. Okay, and this is why I'm a stickler for non-judgment, and I keep very strong boundaries in the community. I do not tolerate other parents judging each other. Like, we're going to have the chat on. If we see it, we're going to be like, hey, not the spirit of the program. If we see it in the community, we will reach out to that person. Okay, so what does that mean? It means every parent is at a different point in their journey. People have different backgrounds. They will be from different countries, different political leanings, different neurotypes. Okay, so every family will be making their own decisions. And that means that some families will completely release screen time limits and experiment with that. Other families might be coming in and need to set some boundaries around screens. And I'm not going to be telling you what to do. I'm going to be walking you through a decision-making framework that will help you make your decisions. School, some parents keep their kids in school, some do not. Some go to private school, some unschool. Everyone is making their own decisions. Siblings, some separate the siblings, some haven't. Some move into separate houses temporarily, some don't. Most don't. Some people continue with applied behavioral therapy, ABA therapy, and some pull their kids from therapy. Okay, so this is not a space for you to focus on other people and what they're doing wrong or what they should be doing. The goal is to make your own autonomous decisions from a place of like, I know this is the right decision for my family, and then support each other through that. Okay? Is this making sense? Yes, I see Nikki, Warren, Megan. Okay. And then finally, there is no advocacy agenda that I have other than your family doing well. Okay. So if you move through this program and you realize, actually, I think in an exposure-based approach is better for our family, I will feel like, great, I've helped them get clarity and now they know and can get unstuck. Okay. So I am more concerned with your peace and your child doing well than I am about PDA, if that makes sense. Okay. My specialization is in helping you support your PDA child and yourself through it, but this is your autonomous journey. Okay. And I'm here to support you on that. Okay. So here's my little bit of tough love that I'm going to get into just to tell you what the program is not. So that we're all clear. Okay, so this program is not a magic bullet. I don't have some secret sauce that I never put on social media or my podcast and I just like wait for it. And then you get in the program and I'm like, here's the magic bullet, or here's the tool that will solve everything. That's not how this works. Your child has a nervous system disability. If you're here and you believe that, I am not a guru. You know your child better than I do. Um, so I don't have a set of like, here's what you should do, here's my advice, here's the tools that will fix it. What we have here is a set of skills that you can learn and master and apply to your own life so that you can find peace with your child and actually support them in a way that's transformational. But one of the things that we do in this program is we acknowledge and identify all the ways where we're still seeking the solution, subconsciously or consciously. And there's nothing wrong with that. I still have moments like that where I'm like, what is the fix to this? Right? Where it's like the nature of our children's brains is that they're either being activated or accommodated. There isn't an in between. There's no gray space with that. And so often there's not a solution to like siblings, school, screens, violence, boundaries. There is a decision to be made between often two crappy options. Okay? So this isn't an online support group, meaning, as I said before, this isn't going to be a space where we're just dumping all our emotional feelings. We can have feelings about what we're doing, and we are here to witness and encourage you, but it really needs to be in the spirit of progress. Okay, so that might be hard to hear, but you can go anywhere on the internet and find free support groups, and it will be very supportive. But again, like, I want to keep this space free from just dumping emotions without taking responsibility for one's own actions. And I do this because I know that it moves people forward and because I know that the people in the program are those who actually want to change. And so when we have too high a proportion of people just dumping in the community, then people get bogged down and they can't make progress. So please take a minute to decide if like you either need to go through this program with a therapist or, if you're ready to see your own role in what needs to change. Okay? This is not a crisis intervention space. I said that a little bit about the suicidal ideation and self-harm. That doesn't mean you can't talk about it as an indicator and you can't express how difficult it is for you. Um, but in terms of seeking like medical advice or crisis intervention advice or putting a lot of that into the space is not appropriate because we are not trained as medical providers. We can provide you with your next step if you do go into crisis and need us to help you find people local to your area who you can reach out to. Okay. Finally, again, this is not a one size fits all. You will have to apply the skills we learn to your specific context, home, child. At the end of this program, your life's still going to be messy. It's not like you take this program and then like your kid doesn't have PDA and everything is butterflies and rainbows because my family and my life is still messy and includes trial and error. But what's different is that I know what to do. I know that I'm on the right track. I know that progress is being made in the right direction. No matter how slow it is, I know that we're moving in the right direction, which is what I want for you. Okay, now we get to Catherine's earlier question, which is like, I think it was like, how much time? Okay, let's talk about the logistics. So what's actually in the program? We have 85 short lessons in a structure that are approximately 10 minutes apiece by module. So it's not a ton of pre-recorded content in terms of what you have to get through each week. And frankly, some families just ignore the pre-recorded stuff until they're done with the live program, and that's fine. But we're going to go through 5 modules, and these short lessons can be watched in your learning library, or you can listen to it as a podcast. They have transcripts and captions and are self-paced. Each week, as you're going through the pre-recorded content or not, we will have live calls for about 2.5 hours on average at 1 p.m. on Wednesdays. So like for module 1, I'm only going to be focusing on awareness, which is like, do we fully understand PDA, PDA nervous system, PDA logic of PDA brain, neuroception, and how it's different from all the other neurotypes that we have. And we're going to do that for 2 weeks. And then I'll coach families through their questions, which you can submit. And then the next module will be acceptance, where we will be practicing the cost benefit decision making. We'll do that for 3 weeks. So there is a structure that I keep to, and it's not just a bunch of people coming off mute and asking me for advice. I'm going to be keeping you sort of disciplined in the skills, and I'm going to be helping you apply them in those live spot coaching calls. So in the beginning, when we're really focused on, the first half of the program, I'd say approximately like five or 6 to 8 families will be selected based on the criteria of how closely does it match the skills in the module we're working on. Has this family been spot coached before? And first come, first serve. And then by the end, and especially when we're doing tracking indicators and getting to the very end of the program, when we're combining the skills, it might be more like 2 or 3 families on a call. But all of you are there participating in chat, supporting each other, witnessing each other. Sometimes if you've asked a question and I've answered it live, I might say, hey, can you drop it in the community? And then I'll help you, or Kendall or Donna will help you with your next right step, right? So if we're working on a skill, I might say, have you thought about this? Or have you thought about it this way? Or, here are some ideas to experiment. Go ahead and try that and come back and we'll troubleshoot. Or I think you're getting stuck here, right? So it's not like I'm not giving advice. There are no shoulds. This is, I think, what makes the program kind of magical, because there's no judgment. It's totally objective. I come at everything neutrally, and there's no right or wrong. It's just what works for your family and helping you see clearly. Okay, but that also means that I'm not going to be like, do this, or this is what I will give you examples. This is what I might say, maybe experiment with this script, etc. Okay, so over the 11 cohorts, every spot coaching session that I've done, except for the ones that people have asked not to share, but it will be turned into a podcast episode, a private podcast episode. So you will be able to hear not just your cohort, but every cohort before and after in a private podcast repository for every spot coaching interaction. So that means like we currently have over 300 episodes on the private podcast. So like any question, like let's say we went through a skill of decision making with siblings and it was helpful, but you want more on that. You can search like siblings and see listen to all the different spot coaching that I've done with other families. So you will have examples from families with a 3-year-old all the way to their 20s. And lots of examples that aren't just my lived experience, although I will bring that in. Okay, you will have 40 plus PDFs to share with your care team, not to start your own business using my materials. Wink. And then you will have live bonus sessions with experts. So you'll have 2 live bonus sessions with a nervous system expert. This cohort will have a responsive feeding developmental pediatrician coming on. We'll have an expert on unschooling coming in. Jake will give the dad sessions. We'll have the teen session with Donna. Um, we'll have the internalized and gifted PDA with Kendall. And then there are other ones that have been recorded from previous cohorts, like a couples and parenting PDA and some others. All the pre-recorded materials that we offer are included. The community, which is moderated by our coaches, so that is on our web platform. That will be for 13 weeks. So the community begins the afternoon of the first Wednesday live session, and it goes for 13 weeks. And I think every single question will be answered by me or one of the other coaches. We tend not to do a lot of work on the weekends, but that's been super helpful for families who are in Australia or who can't make it live, because then they can engage asynchronously. And then finally, after the program, you will graduate into a alumni community. And so you'll have 7 months of a moderated alumni community, which will overlap with 2 other cohorts. The platform we use for the cohorts is Kajabi. So that's our web platform. So we use a moderated community in Kajabi, which is like what our course platform is. Okay, how's everyone doing? I know this is a lot of information, but I just want you to be able to make an informed decision, because I know it's an investment of your time, of your energy, of your money. Okay, great. Catherine, I don't know if I answered every aspect of your question, but feel free to put it in again if I didn't. So, what is the methodology of this program? So the methodology is based on a 5A framework that I developed, which is now trademarked, and it is the 5As. Oh, so Robin, you'll have access to all the materials for your lifetime. So the only caveat to that is we record the videos of me doing live sessions, but those will be turned into the private podcast in an anonymized way to share across cohorts. So we don't share the videos outside of your cohort, because even within the community, it's such sensitive stuff. So we anonymize it before it goes into like your learning library forever. Okay, so the 5A framework, we have module 1, which is awareness. And we learn 2 skills in that module, which is putting on the PDA lens, which is not, for many of you, this is not the only lens you will ever work through, but it is a new lens, because as I said at the beginning of this call, every other lens that you've probably been given, whether it's ADHD, autism, behavioral, educational, has been through an explicitly or implicitly behavioral approach to behavior, like explicit teaching, correction, exposure, rewards, sanctions, consequences. Okay, so we're going to be putting on a radically different lens and focusing on what activates the subconscious perception of threat and understanding the logic of that. And so throughout the 12 weeks, I'm going to be like, it looks like your PDA lens fell off. Let's go back to that lens. By the end of the program, you will feel so well versed in this lens that you can then take it off and put it on. Meaning you can work effectively with a OCD specialist, because you'll be able to understand, oh, that's PDA, that's OCD. Or, okay, I think my child is far enough out of burnout and has enough of a window, and our relationship is strong enough that I can actually remove my PDA lens and work on this executive functioning stuff. Okay, so I want you guys to understand that this is not a dogma of like, you have to believe in PDA and it can only be this. It's like we're learning one way of doing things that is different from what most of us understand and know, so that we're empowered and equipped to see our children clearly and operate from the right logic for them. Okay, we're also going to be practicing the sacred pause, which is a mindfulness approach, which will help us as we're implementing this stuff. Um, I also have some notes here, just like, what do I mean by the PDA lens? Let me give you an example. So a couple cohorts ago, we had continually been putting on the PDA lens, the new logic, and this mom dropped in the community like, I was so afraid to take my son skiing because he won't put on his shoes at home, and it's like such a fight putting on his socks and shoes. And so they had been working so much through the sensory lens when they came into the program. But as she started the program, by the end, she realized like she was afraid to take him skiing because she was afraid he wouldn't wear the ski boots because of sensory issues. But by the end of the program, she realized it wasn't about the sensory aversion, it was about the lack of autonomy, right? And so when she had the accommodations and the novelty of going skiing and all of that and seeing it through the right lens, he was absolutely able to put on the ski boots, right? And she realized like how much of her decisions, the clinician she was choosing, all of the things that she was doing was through not a completely wrong lens because he had sensory issues, but that it first needed to be viewed through the lens of autonomy and the nervous system. Okay, another example. In the parenting space, therapeutic space, teaching space, autism space, we so often hear about skills. They need to learn the skills, right? So I was working with a family whose son had a autism diagnosis, and they were really pushing social skills because he struggled with other children, right? And it was through their interactions with the pediatrician and therapist that there was an emphasis on he's not able to interact with other children because he lacks social skills. So they're pushing him to go to a social skills group. What's happening? He actually had the skills to interact with children, but he couldn't access those skills because he had so much nervous system activation. And in pushing him to try and acquire more skills in an environment where he didn't have autonomy, it was making his nervous system activate more and more and more, making it harder for him to access skills. So, what did they do? They experimented with allowing him autonomy around the social group. He decided not to go. And within 3 or 4 months, he was much more able to engage socially because his nervous system threat came down. Okay, so we have to see this through the right lens, and that's why you're here. Because if more traditional approaches had worked effectively, you probably wouldn't be on this call, right? And so this is an opportunity to see it differently in a consistent and actually very disciplined way. Same thing with like executive functioning of ADHD, right? Many PDA children and teens have ADHD also, but sometimes we see the constant motion, hyperactivity, difficulty with initiation, and we think ADHD, and then we start to accommodate and really shift things, and that behavior improves, and we realize, oh, that was fight or flight, actually. And like, of course, it impacts your executive functioning when you're perceiving there's a lion in front of you, right? So this is what I mean by the PDA lens and keeping those lenses on for the duration of the program as the experiment so you can see clearly. Because there's not really any other way to get the data you need to really understand your child. And of course, you could do this on your own, like of course, but we're doing it in a community that's helping you keeping to put those lenses back on. Um, yeah, and I'll give you an example. So this morning, I had a developmental pediatrician call about Cooper, my now almost 10-year-old PDA son. I could not see what his neurotype was other than the threat, right? And it's only now, after like 5 years, after the first year and a half, we saw, oh, in addition to PDA, he also has generalized anxiety after the first year of consistently accommodating. And then we knew what it was, and we could be like, let's talk to a specialist and get some anti-anxiety medication because it's not just PDA. And now he's doing really well, and his nervous system activation has come down, but we can see more clearly, oh, he still has some executive functioning issues. But we have such a foundation of safety, of relationship, and of bringing his nervous system activation down that I'm finally in a place where I could be like, yeah, we could try some executive functioning stuff, right? But so many of us are starting with the behavioral stuff or the exposure, and if our kids are PDA, it's pushing them away from growth, progress, and into burnout or into the part of their brain where they can't learn, they can't grow, they can't empathize or connect. Okay, so module 2 is acceptance. We will be going deep with the cost benefit decision making within constraints. Okay, so any questions you have about siblings, screens, school, violence, or boundaries, this is your module. And, if you are an economist, which maybe some of you are, it's not that type of cost benefit where it's like there's a clear right answer. And if you're an artist who's intimidated by those words, know that really all it is reducing the chaos and seeing clearly that you only have two options in most situations, okay? Either activating or accommodating your child's nervous system. And what that means is we have to look at the constraints of our lives. We're going to talk about this, what the choice is, and then go through the cost benefit and select and move forward. So let me just check the time. I am happy to go through an example of this cost benefit if you all would like that. Okay, Angela says yes. Okay. Feel free to drop in like what kind of example do you want? School, screens, siblings, boundaries, violence. Screens. Okay. Yeah, there's a there's a even school. Okay. Can't decide between siblings or screens. Okay, let me think. Okay, let's do siblings. All right, so the first thing we do with cost benefit is we first look at constraints. Okay, so there's one constraint that all of us share if we're parents of PDA children and teens, and that is the fact that we're either activating our child and putting them into that survival brain, meaning their nervous system's going to go off and they're going to have a cumulative stress response that will move them towards a threshold. And if they're consistently past that threshold, that's when we see burnout and trauma, or keep them below it by accommodating and keeping them here. Okay? All of us have that constraint. Parents of other types of children, other neurotypes, even non-PDA, autism, ADHD, do not have that constraint. There isn't the direct trade-off, right? So we're always choosing between activating or accommodating the nervous system. And because PDA nervous system activation is cumulative over time, we're either building towards their threshold for what they can tolerate, or we're creating a window of tolerance. So that sounds simple, but often in order to accommodate and keep them out of here, that means not saying no, not correcting them, not putting a boundary down, not putting a limit, because that is what activates them. Okay? So this can feel extraordinarily overwhelming, this constraint that we all have. Why? Because it's a catch-22. You're between a rock and a hard place, right? You have your child, maybe you have an 11-year-old PDA and a 3-year-old neurotype undisclosed child, and they're berating the 3-year-old. If you put a limit down, it will activate their nervous system. If you accommodate it, they'll stay in their thinking brain, but it's abusive towards the 3-year-old, right? This is a horrific situation to be in as parents. It is a unique experience, and it's one that I would never wish on anyone. However, within this constraint, if we start to see it and radically accept it, we can start to make decisions and find our agency within those constraints. So let's think about this through the lens of siblings. Before we get into a cost benefit, I would love to talk about constraints. So these are personal, family, financial, geographic. So if we were working through this, we would just name our constraints, right? And we can take a minute to do this. So for example, it could be I'm a single mom. It could be my partner works really long hours and isn't on board with accommodating. It could be, you know, we're financially too constrained to consider private school. It could be I'm neurodivergent myself, I'm PDA, and so my nervous system gets extra activated. It could be I have childhood trauma and relationship trauma, and so the behavior that's coming at me is really hard to diffuse using an accommodation, right? So if you would just take a minute, we'll take 2 minutes, and we're not going to judge our constraints. We're going to recognize that these are unique and specific to each family context. Let's just throw in the chat, if you feel comfortable, what some of your constraints are that are unique to you. Bye, Eileen. Thanks for coming. So it could be, I have 3 kids. I have 4 kids, just like what is unique to you. Amy says 3 kids. Unable to access school. One parent must be the caretaker. Childhood trauma, single mom. Yep, no family in the area. Great. Partner seems wedded to traditional discipline. Awesome. Neurodivergent myself, single mom, family trauma. Great. So I'm not saying great in the sense of like, yay, trauma, but rather like, yay, we're making these explicit and we're not judging. We're not judging ourselves, but we're starting to see how we have certain things that are constraints that we can't change today. Okay. That doesn't mean like you could, if you're single, can never get married, or if your finances are one way, it can't change. But a constraint is something that when you are making decisions in the moment, you can't change. You can't change your geographic area. You can't change your marital status, all of that. Okay. So we just acknowledge that and make it explicit. We acknowledge the constraint that all of us share, which is the activating or accommodating. We can't change that either. That's how the brain works of our child. And then we look at whatever question we are struggling with. Okay. So, and this is part of what I can help you do. Like a lot of times parents come to me and they'll submit questions like, my kids are trying to kill each other. They won't stop fighting. It's always screaming. I can't make them stop hitting. Help, right? I'm here to say, okay, like this looks like a cost benefit decision. Let's get off mute and let's talk through what your actual options are. So let's say we have a situation, I'm just going to take an example from a previous cohort where, and I'm going to simplify it a little bit. I'm going to choose a simple one where a mom, her constraint was that her husband worked full time. She was a stay-at-home mom, and she had two kids. And she had a PDA 5-year-old, and she had what she thought was a neurotypical 1.5-year-old at that time. And so she was saying, like, what do I do? Like, what do I do when the PDA daughter is trying to hit the non-PDA sibling, but when I try and stop her, the PDA child activates and comes after me, right? So the first thing we're going to do is we're going to look at our choices. And this is part of what this process is, because parents want me to say, this is one of the most transformational skills. Parents want me to say, oh, if you say it this way, or if you use this script, or maybe if you strew it this way, they'll stop. But rather than the solution, we're going to move towards what's the decision. Okay, so we broke down what are your two choices. You can, I have them do their two choices. So she can either set a boundary, like she can either put her body physically between her daughters, she can remove herself and the 2-year-old, or she can remove the PDA and leave the 1.5-year-old maybe in a like safe fence. Because of the constraint of her husband not being able to afford childcare, we don't have those other two options. So we have, these are the 3 ways we can operationalize the boundary, or we can not set a boundary. Those are the only 2 options. Okay, this is triggering because we want there to be a solution. So then we look at these 2 shitty options. If I don't set a boundary, my 5-year-old is abusing my 2-year-old. But if I do set a boundary, my 5-year-old's going to escalate and scream and hit me, right? And so what do? We look at these 2 options and we radically accept these are the 2 options. And then we go through for first the PDA child. Okay, option 1, what's the cost to the nervous system of not setting a boundary? There is no cost because there's no limit. What is the benefit of not setting a boundary? The benefit to the nervous system of the PDA is that it doesn't get activated. And then we look at it with the other, which is the opposite. If I set a boundary, it will activate the nervous system of my PDA. If I don't, there's a cost to setting the boundary and there is a benefit to not. But then we put it into the family system. Okay, and this is what makes this unique as well. We then go through, okay, what's the cost benefit to the nervous system of the 1.5-year-old? What's the cost benefit to the mom's nervous system? What's the cost benefit to the partner's nervous system, even if they're not there, right? And so we look at this not setting a boundary. Okay, the cost to the 1.5-year-old's nervous system, there's a high cost. The benefit, no benefit. The mom, what's the what's the cost to the mom's nervous system of not setting a boundary? Huge cost because she's watching her 1.5-year-old get abused, right? And so we go through the family system and we look at it through the nervous system lens and we compare our 2 choices. And often it's 2 shitty options. Okay? Not always. Siblings is a particularly difficult one, and there's 2 things we have to do. We either decide one of the 2, which might be I set a boundary and I'm going to operationalize it like I'm taking me and the 1.5-year-old out and my PDA is going to activate and maybe come after me and bang the door, etc. Or we re-examine the constraints. We look at the finances again. We look at the dad's work schedule again. Okay, so what we're doing is we're taking these chaotic, overwhelming questions about siblings, screens, boundaries, violence, school, and we're going to break it down through a nervous system lens of cost benefit to each of the relevant parties, starting with the PDA and then putting it in the family system. And I don't tell you what to do, right? I'm gonna reflect it back to you and say, okay, this is what I'm hearing you say. We've done the cost benefit to each person in the family. We can either choose one of these two options or re-examine your constraints. Okay. And what this does is it brings up a lot of grief and resentment and frustration because you want there to be a solution. You want me to say, like, oh, if you say this script like this way, it won't be like this, right? But this is the most powerful skill that you learn because it starts to move things. You start to accept not your child, just your child in the theory. You start to accept the constraints of your life and see it more clearly, and you start to get unstuck. Sometimes it's very clear. Like sometimes when we do this, it's like we realize a certain decision would be better for everyone, but like someone's getting stuck with their childhood trauma and it's activating them to do it a different way. Like that sometimes happens with like a dad or a mom. So that is a very brief overview. We would do this in relation, right? Like you learn the skill and then during the live call, you submit a question ahead of time about cost benefit. Well, usually people submit it and then I'm like, this is a cost benefit question. And then we do the cost benefit together. Okay, is this making sense? And I will tell you, after working with, 2,000 families, this is where people get unstuck finally. But it does bring up grief. And so that's why we have the nervous system support as part and parcel to this program. Okay. But for many of us, myself included, we're avoiding confronting some of these deep truths. And we need to feel a sense of belonging and connection to move through facing them together. Okay. Um, so then we move on to module 3, which is the skill in module 2 was cost benefit decision making. The skills in module 3 are measuring and tracking indicators, which I talked about at the beginning of the call. The 12 accommodations. So we have preventative accommodations, which we learn to do all the time. Autonomy, equality, lowering demands, humor, play, strewing, communication accommodations, nervous system safety through nonverbal signals based on polyvagal theory, novelty, dopamine, and sensory. And then responsive, diffusion, de-escalation, and risk mitigation. So those we will learn how to actually implement and you'll practice them. And when you get stuck, you drop in the community or you submit a question and we'll help you move through it. Module 4 is the 4th A, which is affirmation. So we go through a process of building skills around naming the nervous system. We're going to be building on the accommodations to name the nervous system with your PDAer and support them in autonomous process of figuring out an affirming identity for them or lack thereof. Some PDA kids don't want to talk about PDA or be PDA, and that's fine. Autonomy is the name of the game. But what makes this approach really unique is we take diagnosis, identity, and naming the nervous system, and we separate those 3 concepts and treat them differently. Okay, and then finally, module 5, which is advocacy. We're going to be flipping the script around how we normally think about advocacy, and we are going to be learning nonviolent communication for making specific requests for what you and your family and child need with example scripts. We're going to be learning to set boundaries. And we are going to be continuing with cost benefit decision making around who you need to set boundaries with. Because some people are never going to, quote, be convinced or learn about PDA. And you may be expending an extraordinary amount of your own regulation and energy trying to make that not true. So we're going to be preserving that energy and acting differently to get your family on a path to living a life you actually want to live with your PDA child or teen. Okay, so I believe this will be the foundation for you, not just for these 3 months, but for years to come. These are skills I still use on a daily basis and constantly am coming back to help myself have sanity, clarity, and peace in this journey. For example, I'll give you an example from a year ago. So, my son now, he has been playing tackle football for 2 years. But when he first wanted to play tackle football, I was A, extraordinarily surprised, and B, very hesitant because I was afraid it would be too much on his nervous system. So, but he really, really wanted to do it. And so what did we do? We thought about we did the cost benefit decision making around his nervous system. We decided to allow him to do it and then went back to our skills of the 12 accommodations. Like, okay, how can we bring all of these into his football experience? One of the big ones was his dad being an assistant coach as the safe nervous system because he did have lots of panic attacks. But we reached a point where we were very confused. We didn't know what to do. Why? Because 2 out of 4 football practices, he would have a huge panic attack and be kicking and screaming, not screaming as much, but like crying, teeth chattering, and just not be able to get through the end of the football practice. However, he kept wanting to go back and he kept insisting that he wanted to do it. And he would sort of come out of the panic attack and be like, wait, practice is over? What happened? So kudos to my husband for doing all this accommodation. But in terms of our decision making, one of the things we've been very consistent with is this tracking indicators and cost benefit decision making. And so we looked at it through that lens of like, okay, he's reaching his threshold each time he goes to this practice, but we're doubling down on accommodations everywhere else. And if we're looking at our 3 indicators of engagement and connection, his basic needs, and his nervous system activation overall, on average, are things getting better or worse? Okay. And what we realized was like, okay, his eating's improving, his sleeping's improving, his digestive system and toileting has not been, has not slid backwards. Okay, that's one. Engagement and connection. Equalizing has not increased towards his brother or towards us. He's not outside of the practice having more meltdowns. And his connection and healthy self-concept has continued to improve. And so, and then even though it was hard, sending him to those practices where he would have that activation, we could see clearly the cost benefit and we decided to continue with the football because based on those indicators, he was not moving back towards burnout with his cumulative nervous system activation. And this year, I'm happy to say, it was not like that. He was not on the edge of his threshold the whole time. But these are the types of skills that I believe will serve you for not just these 3 months, but the entire lifespan of your parenting. And the idea is that you are modeling these skills in a way that your child will learn them from you through observation, through experience, and it will become their skills for managing their disability as they grow older. The other thing I want to just clarify as like an asterisk is when I talk about activating or accommodating the nervous system of a PDA, and we're thinking about cumulative nervous system activation and the idea that we're either activating or accommodating, the good news about that is that you don't have to always accommodate. We just want the proportion to be high enough so that they're not moving towards their threshold and moving towards burnout. So the good news is, even though it's uncomfortable, is that, if you're a parent and the other parent isn't on board, you can still move the needle with your accommodation. Or, we have to set boundaries sometimes. And so that one time you set the boundary, yes, there will be activation, but over time, if the other 5 times you are not correcting them for something that's not actually necessary, it's more driven by your fear of like, well, if I don't correct this now, then we can actually make a lot of progress. So it's not about perfection, it's about accumulation over time. Okay, so that, my friends, is the content that I have for this call, but I also have the Q&A. So I will go through that. Okay, so how is this a choice though? Are you not obligated to defend the younger one's well-being? How could taking non-action to avoid activation in the PDA child ever be seen as a choice? So I approach everything neutrally without a normative stance of just like we're opening our minds to think about our agency, right? Of like, you have choices. You can always make decisions, right? And we don't judge others for not making the same decisions that we do, right? So there have been times in my own life where, especially when my son was in intensive burnout and we separated the kids most of the time for like 4 years, where, he would do something like walk by and knock over a toy or say something, and I wouldn't necessarily correct him, but I would diffuse the situation. That was my choice because at that time, the cost of setting the boundary would have been so high that he would have activated in a way that would have made him more abusive to my son. The point of this is not what's the right answer or what's the right choice. The point of this is to see clearly that you can't actually make it not this way. These are actually the choices that we face as parents, unlike parents who don't have PDA children. And I'm just reflecting back to you that truth. It's triggering. You don't want it to be that way, but this is part of moving towards radical acceptance. So if our only two choices are we set a boundary and our PDA child comes after us, like especially an older one, I've worked with families where the mom had to like hide in a closet and they were like banging on the door, a 13-year-old boy, or we don't set a boundary so they don't come after us. Maybe what we see is we have to re-examine our constraints and see it radically differently, right? And then we can think outside of the box of like, maybe we need to reconsider our school decisions, or maybe we need to invest in another person who can be one-on-one with the sibling, and I need to be body doubling or providing nervous system safety to the PDA. So there's always a choice. And I'm not here to judge people's choices. I'm here to help you see clearly where your agency is and get out of the seeking solution, looking for a magic bullet path that many of us get stuck on, myself included. Trying to shorten that timeline for people. But if it doesn't resonate, that's fine. It's okay. Okay. Questions that you guys submitted. So Natalie asked, will you cover kids that choose to go nonverbal or have selective mutism and strategies to help them? So actually, almost all the strategies, even if we use language, are applicable to non-speaking. because most of what we're doing is signaling safety to the nervous system and the subconscious, which doesn't require words. And in fact, often is better if we're not using a lot of words. And you might have noticed this if your child is like, stop talking or shuts down when you're trying to have verbal communication. So, in the last cohort, we had a couple non-speaking parents of non-speaking autistic children um, who got a lot out of the program. And actually, a lot of the things that they had intuited to do with their child were applicable. I also see selective mutism in PDA kids often as a dorsal response, meaning a shutdown response where they lose words. So, in the case of one of the women from last cohort, actually, this usually happens in each cohort where the child acquires more and more words. And we're not working on that at all. Like, we're not working, you know, we're not working on speech language pathology. We're not working on trying to get your kid speaking. We're working on bringing down the cumulative nervous system activation and supporting safety so that your child can access learning, connection, etc. Okay. And so I can't guarantee that that's going to happen, but that is an indicator that does improve over time from the families I've worked with. Okay, Jen, sorry I can't make the live call. Not a problem. We have a 12-year-old who is not in full burnout, but we have just pulled them from school. A lot of what you describe is for kids in full burnout. I'm curious if you think your course also helps kids and parents in these in-between stages. Many thanks. So I think it matters more, not whether your child is in burnout, but whether or not this feels like a good fit, right? Energetically, structurally, methodologically. We have families who, have just learned about PDA last week because they saw a TikTok video. And then we have families who maybe have been, you know, learning about PDA for like 3 years. And maybe they're PDA themselves and they're really well versed. And I think both can be a really good fit if the core of radical acceptance and letting go of what you can't control and moving through that healing, the grief and then healing, is something that you're ready for and interested in. Yeah, I mean, I have actually been surprised that we get more families who are very well versed in PDA than people new to PDA. Um, I mean, not in full burnout, I think. Yeah, I think we work with a lot of families whose children are not in full burnout. This is, why we learn to track indicators so that we can understand your baseline, make sure your child doesn't go into full burnout, know when we're moving towards or away from it, learning to make decisions around deepening accommodations if they do start to hover around that. Because, my son's out of burnout, but he's going to be going into his teen years. He's going to be in middle school. Like, I may have to make different decisions around a lot of things as social complexity increases or if things change with his school. And so, really, these are skills we can take with us to use throughout their lifespan. Okay, hope that's helpful. Okay. All right, Eileen, I've been learning about PDA the last 2 years, feeling pretty accepting of it and feeling like I understand it fairly well. Not that any of it is easy. My kid has never been in burnout either. Will this course have enough for someone not at the very beginning of learning PDA? I'm worried about not feeling like I'll get enough out of it, but also really wanting some PDA specific advice about my kid. Would coaching with Kendall or some other provider be better? So, as I say, there's no like shoulds. I think one of the things that you get out of this is the belonging and connection to a group of parents that are trying to like take radically different action to improve their lives, we get a pretty high quality group of people. Um, that's away from social media. And, I'm always trying to stay on the cutting edge, not just of the research, but also in mindfulness techniques and nervous system healing. So, if that's the area that would be of service to you, absolutely. Um, but if you want someone in the privacy of a call each week that's only talking about your situation and you're not in the energy of a group, then maybe coaching would be better. Yeah, that's my answer. Hope that's helpful. Um, Allie, if we do your program, would you also recommend individual counseling for our PDA son or family counseling, or is this program enough to help us? We have money to do either this program or private counseling, but not both. Which would be more beneficial? I do not know what would be more beneficial for another family because, again, I don't know anything about your case. I think the thing this is how I would think about. So, like, this program is like your foundation for everything you need to make decisions, advocate, accommodate, and teach others in your life how to do it. And so, sometimes, often, and I've done this myself, I spent a lot of time seeking someone who could plug in or building a team of like therapists, occupational therapists, um, pediatricians, experts in play, and thinking if I just find the right expert, then this will be easier, right? And like, I did not want to like learn how to play. I didn't want to have to like do it myself. I wanted to hire someone to like do it with my kid. Like you see, if your child has an autism diagnosis, you see like, okay, they have a team, they do this ABA, and like you kind of get to sit on the sidelines. Um, Fortunately or unfortunately for us, we're very much on the cutting edge as parents of like PDA is not well understood professionally. It's just not. And so you have to be very, very, very discerning and you're going to have to teach them. And so this program, I mean, it's the deepest, most comprehensive, dorky, nerdy thing I think you can do to like really be well versed in it. Like you can go as deep as you want. Um, and nerd out with fellow nerds like myself. And so that could give you the foundation for like making sure A, that person is the right counselor for your child or family, and B, filling in the gaps where they actually don't know what they're talking about and give you the confidence to do so. Um, but, if you have an amazing practitioner who can like be one-on-one with your kid and give you an hour-long break where you don't have to be the nervous system, that's gold too. Like my son goes to occupational therapy and we have this incredible OT that we've trained, but was open to do it. And now, I'm involved in the OT, but it is like an hour when it's like someone else can do some of it. And that's really priceless too. But sometimes we have to like really be solid and confident and empowered to get to that point where we can hand it off. I hope that helps you make your decision. Okay, Megan, I noticed that in the social media content, the same examples are repeated, often about her own son. Yep, that's me. Well, I find the concepts relatable, the examples aren't relatable. For example, when her child's drive for autonomy overrides his drive for safety, the example of running into traffic. Yeah, so that was an example from burnout. He would no longer do that. Um, my son wouldn't do this, but I still think this is a survival need that he compromises on. I'd love to hear more nuance and examples to get a sense of the range of profiles out there. Okay, so this is, I think, part of what makes this a cool program is because in the moderated community, there will probably be around 100 families participating. In the beginning of the cohort, there probably is going to be like 100 to 120 families participating in the live calls. By the end, it'll be like 45. I know this because I've done it a lot. Um, so you're going to get to hear examples and stories on a daily basis for 12 weeks and then 7 months in the moderated community for alumni of like hundreds of other families. And you're going to have a repository of over 300 podcasts where each one is me spot coaching a family in their unique case. So you're going to have examples of like gifted, OCD, PDA, internalized 18-year-old, 2.5-year-old, right? And there's a lot of richness and nuance to these like other family examples and truths that you get to hear. Um, I in the pre-recorded, we have examples. We've tried to do examples of like kids 3 to 10 and then examples 11 to 18. And then you will, if you haven't already bought the foundations course, and if you did buy the foundations course, we'll reimburse you if you join the program. But the foundations course will be included, and that also has like, I don't know, like 100 written examples of not my own son, but anonymized client or family examples from our coaching work. Kendall co-wrote that with me. So yeah, and then you'll hear lots of examples, all the examples. Yeah, so it's definitely different than social media. Like we're intimate in this program, even if I'm not like your one-on-one coach, like you're going to be hearing from other parents. They're going to be sharing vulnerably. There will be tears, not mine usually, but sometimes. No, I tend to keep it together and stay in the logic, but tears are welcome because we're processing. Yeah, I mean it's a raw thing that we're going through. Okay, Chris. I believe the course will be a good fit for my family, but I'm trying to still work my way through the foundations course right now. Is it possible to remain on the wait list for the next session of the Paradigm Shift program? Yes, it is. And our next enrollment will be late April for a May cohort. So we run it 3 times a year. Um, and yeah, just think about like, is this the right time? Are you ready to make the shifts? You know, can I get the most out of this program right now? Obviously things come up. We know the space that we work in, right? Like we're well versed in the PDA space. We know that families have things that come up. So like, if something happened, you could always email us and we could help you out if you invested and couldn't actually do the program this time. But before you make your decision, just think about like, is now the right time for my family? Yeah, and if you don't want to join now, you can always join the next session. But you do have lifetime access and there's like no rush, right? Like you can take as long as you want to go through the materials. And in fact, you can't get through all the materials in 3 months unless you do it as a full-time job. I'll just be honest. But there's a reason for that, right? It's like we're deepening, we're refining, we're going into nuance, we're exploring healing. There's lots of stuff going on. Okay, Nicole, my son is getting wildly out of control using foul language and the words like butthole and poop. We've done all the things. Laugh with him, tell stories, talk about how we can't say things around people because of our low demand approach. It's getting worse and worse. In fact, he's scared of everyone he doesn't know. So he calls them fucking buttholes, not to their face, but to us in a voice that can be heard by others. Do you have any suggestions for us from a PDA lens? Okay, so I really like this question because so often families come into this program and they've come from like a low demand approach, right? And you might have seen when I was going through the skills that lowering demands is one of 21 skills, right? And it's a very powerful and effective piece of the puzzle, but we also have all these other approaches that we're experimenting with, and one of those is making decisions around boundaries. right? And so with this PDA child, yes, setting a boundary or correcting in the moment will activate the nervous system and potentially make him more likely to say that. Um, but we can think about it in the context of like, is it worth it to set a boundary around this? Or do we need to look at this as an outcome of cumulative nervous system activation and see other areas that we can focus on to bring down the nervous system activation so that they're not getting to this point where they're having this nervous system reaction? Um, the other thing that we would start with, like, this is why the 5A framework is impactful. Like, if Nicole brought this to me, we would first go to PDA awareness. We would go to the PDA lens, and I would work with Nicole to understand, like, is this a PDA response? And through the logic of that, like, is this an outcome of perceived cumulative perceived threat? And every step of the way, she would be telling me what she believes to be true. Like, I'm not here to be like, this is what's true and this is what you should do. Right. And then we would move into cost benefit decision making. And then once we made our decision, we would go into the tracking of indicators. So maybe this is an indicator we would want to track over time and experiment with our decisions and accommodations. And we would hope to see a shift. And then we may need to be working on affirmation, which is like his self-awareness on this, and potentially for a time, boundaries and nonviolent communication with those who are receiving this language, right? So we would apply all the skills and the structure to this particular question. But without me knowing, Nicole, you're like, without getting that back and forth, it's hard to like help you find where you might be getting stuck. The thing that first popped out of me was the low demand approach because it's so often a place where parents stall out. Does that make sense? Okay. Or plateau. That's what I would call a plateau. Okay. Kara, can you share some verbiage to use to explain to my son's middle school teachers how to best deal with him when he is defiant? They assume his behavior is attention seeking and then give him a referral, further cementing this idea in his brain that he's a bad kid. It's heartbreaking. I know how inherently good he is. So it is heartbreaking, and I know that he's a good kid. So, I would probably, Kara, take you back to PDA awareness, putting on the PDA lens, taking a sacred pause. We would go through some cost benefit decision making around, like, you know, do we want to advocate? Is this effective? Then we would identify using the 12 accommodations, like what accommodations do we actually need in the classroom to bring down the nervous system activation so that he's not having this behavior over the long term. And then we would really dig into module 4 skills, which is making nonviolent requests and using some scripts to the teachers that may or may not have anything to do with, like, this is what PDA is, right? It would be specific requests about their responses to specific behavior. And we would practice that as a skill either in the community or on our live sessions. So that's like how I would approach it with Nicole, like on a spot coaching, but it would very much be back and forth. Um, I think some of the the simplest language that we can use is like his body's having a really hard time. Um, we found that a trauma-informed approach is more effective for his severe anxiety. Um, using the language that bridges the gap without getting into this whole debate over whether PDA exists, which often ends up in kids not getting accommodated because it's not in the DSM-5. Okay, Kim, how to go about any kind of discipline or consequences. So as I said at the very beginning of this call, I'm teaching you a very different way. which means we're not going to be using consequences or discipline in the sense of like you get a punishment or a reward. I'm teaching you not to think like that. And it's really hard not to think like that. And it's a huge mindset shift. It's also completely transformative for your home with a PDA-er. But yeah, I don't teach consequences or discipline. That's something that you can get from a million other parent coaches or therapists, and it's why I do the work that I do because it's filling a gap to actually help the PDA children and teens get out of burnout, lower their overall threat response, and be the cool, creative humans that they are that are obscured behind this constant threat perception that gets activated when we use more traditional approaches to them. Okay, so Tina. Although I'm always open to hearing new strategies, I'm quite along my journey of parenting my externalizing PDA, or is this program more for someone who's at the beginning of their journey? It depends, right? Again, like, do you want to be in a community of other people? Do you want to be deepening your confidence with these skills, or do you feel really confident? Um, do you have a community? Do you feel like your nervous system is doing well? Do you feel like you understand yourself and how to achieve peace in this journey? If the answer is yes, like don't join the program. You know, like no reason to. But those are all the things that we're doing together. I'm not trying to be flippant, but it's like I can't make decisions for other people as to whether this is a good fit. Okay, so another question about like my kid isn't in burnout yet, but would it make sense to hold off until next round? So, it really depends. Like sometimes for parents, it can be hard if your child, especially if they're an externalizer, is full on in burnout to actually attend to the material and engage with it because they have to be constantly one-on-one signaling safety and they can't divide their attention. Um, So, other families find that the perfect time to be doing it because they're totally focused on it and they can implement shifts right away. Um, I think you just want to strike a balance. Like, I wouldn't want you to join the program if you felt like you couldn't do any of it, right? That sounds kind of obvious, but like, if you're in such a state that like you don't think you could even get through any of the material right now, like don't join because you'll be unsatisfied. Um, and we will do everything in our power to make you satisfied, but what occasionally happens is that a parent will join, realize that they're in so much crisis, and then we will have to, Jake will have to do his lovely customer service thing of reimbursing and getting them their money back, which, it's fine. It's just we would prefer you to make the choice up front, and be ready to invest your time and energy because it is hard work, right? Like this is a serious program. We're serious about it. The people who join are serious about it. And I want you to get the most out of it. So just please consider. Yeah. Sarah, my husband is very time poor, works a lot of long hours, days and nights. Is there a time frame that we have to complete the course in? No. You have this program for as long as it exists. Even when it doesn't, like, let's say I was like, I'm done with this business 5 years from now. We will send you the videos. Okay, so like you will have the videos, you will have the PDFs, you will have access to things. It's meant to be lifetime access. It is meant to be a one-time investment. This is why I don't run a community that you continually have to pay for, because I truly want you to learn this and then graduate out of feeling like you need, quote, need me, which you don't, because you are the catalyst, right? It's just helping you have the confidence. Yes, you can move at your own pace. I think, yeah, however long that may take, absolutely. I'm more flexible with my time and complete it on my own, but would like him to be involved in the process. Yes, so for each family household, you get 2 logins that are distinct and unique. So if you are separated or divorced, you and your partner can each have a login, even if you don't live in the same house. If you're a single parent and like you have a caregiver, you each can have one login. We designed it this way so that parents can move at their own pace because, as we said at the beginning, the non-lead parent often goes at a slower pace of acceptance and moving through. So let's see, what time is it? It's been 2 hours. You guys are like such rock stars. Um, I am happy to answer any lingering questions that you may have before we drop off, but I know it's been a while that we've been on the call together. But hopefully this gave you the information that makes you feel confident in whatever decision that you are going to make. Yeah, so you're so welcome, Nikki. It was nice to meet you. Thanks, Herb. Thanks, Joe. You are so welcome. Yes. And don't feel pressure. If you can't join now, you can always join in the future. Yeah. All right. Well, I'm going to wrap it up, my friends. I will see some of you in a little bit, in 2 weeks. All right. Have a good Friday. Okay.